Hi everybody, it's July and this month we'll be taking you through reproductive health conditions in youth. Well, reproductive health conditions in youth are health problems or disorders that affect our reproductive organs and our sexual health. There are lots of reproductive health conditions that can affect our health, of which some may include sexually transmitted infections, menstrual disorders, polyendocrine metabolic syndrome, testicular disorders, endometriosis, infertility, HIV, and so on. These conditions are common among young people and can affect anyone. Surprisingly, many people are unaware of these conditions, and even when they are affected, they continue with their daily activities without realizing that something is wrong. That is why I am here today to take you through some of these common reproductive conditions, raise awareness about them, and help us all become mindful of our reproductive health. For this session, I'll be taking you through endometriosis. Endometriosis is a painful condition in which tissue similar to the lining of your uterus grows outside the uterus. The tissue can be found on the ovaries, the fallopian tubes, and other tissues within the pelvis. In rare cases, it can even spread beyond the pelvic areas. Some people may experience it within their palms, on the soles of their feet, and even it can also affect their lungs. Just like the lining inside the uterus, the tissue thickens, breaks down, and bleeds during each menstrual cycle. However, because the blood has no way to leave the body, it can cause inflammation, pain, scar tissue formation, and other complications. Endometriosis affects about 1 in every woman and 10 girls of reproductive age worldwide, and it is most commonly diagnosed in women in their 20s and their 30s. Common symptoms include persistent pelvic pain, painful menstrual periods, pain during sexual intercourse, heavy or excessive menstrual bleeding, pain during urination or bowel movements, especially during menstruation. There are some risk factors that can push you to developing this condition, and some of them include having short menstrual cycles, having long and heavy periods, a family history of endometriosis, and never having given birth. Right? Possible complications include difficulty getting pregnant due to scarring or blockade of the fallopian tubes, bladder or bowel problems, because this tissue lining the uterus can also be found within your bowels, right? In rare cases, chest pain when the tissue affects your lungs. Well, it's right for you to consult the clinician for medical directions whenever you have or experience these kind of symptoms. Yes, although there is currently no cure or treatment that can help manage the symptoms and improve the quality of life, the clinician will give you all needed treatment therapies. Right? There's nothing to fear about. Just consult the doctors or consult a clinician and everything will be fine. Endometriosis is real, it's common, and is often overlooked. If you or someone you know experiences severe menstrual pain, heavy bleeding, difficulty getting pregnant, it's advisable that you seek medical attention because early diagnosis and treatments can make a significant difference. Thank you.